Hi, this is Jeff, and I'm with Sinclair Health Clinic, and today we're out on site at Highlands Food Pantry where we are giving flu shots to families here who are picking up food at Highlands Food Pantry. Highlands Food Pantry is a terrific um, operation and organization. It's run like a finely tuned Swiss watch. They have volunteers all over the complex, and they serve families who are picking up food. And today they have Sinclair here to give flu shots. And I want to talk to you about a flu shot as well and what it means and some of the questions that we get here. So I want to walk you inside here to the church where we set up our makeshift flu shot center and show you the room where we are. Here we are in the flu shot room. Back there is our technician, Amanda. Hey, so let's go talk to her because there are some things that people are asking as part of the flu shot clinic that I want everybody to understand. Now, first and foremost, it's important to understand that for today, and we are here today until 11:30, then tonight we come back from 6 to 7:30. Then we're here next Tuesday, 9 to 11:30, 6 to 7:30 as well. But when we are here at Highlands Food Pantry, it's only for the families of Highlands Food Pantry. But there are some questions that have come up as people have been getting their flu shot that I think would be interesting to have a conversation about. And I want to talk to Amanda about it because I only push paper, but she actually knows what she's talking about. So here we are. Say hello.
Hi.
So there have been some questions that have come up about flu shots. And the big one I hear a bunch is, can the flu shot give me the flu? Can the flu shot give someone the flu?
No.
Why?
Well, this flu shot is a killed vaccine, and it doesn't give you the flu. It does help you create an immune response in case you encounter the flu virus after you've had the shot. So lots of people should be getting the shot, those who are pregnant, older adults, younger children, basically everybody for the most part. But people who are at special risk, people with asthma or diabetes are ultimately ideal candidates. But generally, most of the public would be eligible and could benefit significantly from the flu shot.
So if you have a pre-existing condition like diabetes, let's say, it's not accurate to sit at home and think, I won't get the flu shot. I already have something that I'm dealing with, and the flu shot will make me sicker.
Absolutely. In fact, the flu shot will help protect you. Additionally, we want to encourage people to get the flu shot. Some people have a myth that the flu shot might help prevent them from getting COVID. And that is not the case. It doesn't help prevent COVID. However, it can help prevent symptoms that might be related to COVID, such as a cough or a pneumonia like incident. So we want to really encourage people to come out and get their flu shots.
Now, here's the thing. I'm just going to embarrass you a little bit because while we've been here, the other thing I've heard a lot about people who are getting their flu shots is that it doesn't hurt, and they're shocked that it doesn't hurt when they get the flu shot. Is that just because you're exceptionally good at giving flu shots?
No, I do have a lot of experience giving flu shots, but no, it's not really, it's not painful. And of all the vaccinations and immunizations that we tend to give, this one really does not typically cause too much trouble. For some people, we can have an injection site reaction, a little bit of soreness or tenderness, maybe a little bit of a lump, but that typically goes away. And I usually encourage people to move their arm around once we give the shot, work it into the muscle and things like that. But typically it's really not painful and it's quick and easy.
So we ask about egg-based allergies prior to giving a flu shot. Can you just explain why we ask that question?
Yeah, so previously a lot of the flu shots had some excipients or components that could kind of cause a little bit of an allergic reaction. However, those have largely been moved out of the immunization manufacturing process. And so though we do screen, we still screen people that might have an allergy or a reaction. Most people do very well with the shot. And again, it's the benefit of getting the shot typically well outweighs risk.
So we're here at Highlands Food Pantry because we're Sinclair Health Clinic, and that's just what we do. We move around the community and try to help people. For those who are not families of Highlands Food Pantry, they can come over to the clinic actually and get a shot if they're a patient with the clinic. Right?
Absolutely.
Yeah?
Yeah, absolutely.
And one of the great flu shot givers can give you a shot, or Maureen, there running the pharmacy, will give you the shot. But somebody, and it will be painless or painless, less pain.
Less pain than getting the flu, that's for sure.
It is. And the last piece is that, and somebody said, gee, I got my flu shot last year. I still got the flu, but it wasn't as bad. Mm-hmm. So it is true that you can still get the flu after getting the flu shot, but the flu shot will help reduce the symptoms of the flu. Is that right? It
typically does, and that's because your body has been able to form an immune response to the virus. The virus can mutate over the course of the season, so sometimes it mutates and we still end up with the flu, but it typically does dampen our reaction.
No, thank you so much for taking the time to talk with us.
Absolutely. Thanks for having me.
So we are, again, here at Highlands Food Pantry, primarily for those families who take advantage of the services of this tremendous volunteer operation here. It gets a lot of community support. Scouts and other churches and other civic organizations bring food in. They have this, it's really cool. They have this kind of rolling ramp out on the street, and the food comes in and it rolls down to the basement where just kind of all of these volunteer workers sort it, put it in the bags, and get it ready to go out to the families. It's really terrific. And so we're pleased to be here to help out the best we can for flu shots, but you should get your flu shot. That's what we're trying to say here today. And we want to make sure that you understand all of the factors around the flu shot, because at Sinclair Health Clinic, we're about trying to keep you as healthy and happy as possible. So you take care, wear your mask. Talk to you later.